The Scottish Government has said the vaccine certification scheme, which was introduced at the beginning of October, has contributed to a small rise in vaccinations among younger people. The scheme currently applies to nightclubs and other large events. It also says that the effectiveness of COVID passports working to limit transmission through the festive season depends on boosters being rolled out quickly. First Minister Nicola Sturgeon is expected to announce next Tuesday whether the Scottish scheme will be widened to cover theatres, cinemas and some other licensed and hospitality venues.
Tonight, as the NHS heads towards its toughest winter yet, hard choices ahead on how to control COVID cases. The message from one young survivor who has spent this week in hospital is clear.
I wouldn't want to feel the way that I did again, so if we can try and prevent that in any way, then I'd definitely try and get vaccinated.
Good evening. Tough choices may have to be taken to suppress COVID this winter. The current vaccination passport scheme is working, but may not be enough to ensure the NHS does not become overwhelmed this winter, according to a Scottish Government report today. It's looking at ways to get it under control, which could include limiting social contacts and closing venues, or extending the current vaccine passport scheme and possibly adding lateral flow tests for entry to venues.
An announcement on the way forward is expected next week. But whatever the outcome, there are still concerns that too few young people are getting double jagged. Tonight, we speak to one healthy 26-year-old who, despite being fully vaccinated, has spent the past week in hospital. Polly Bartlett spoke to him shortly after he was discharged this morning.
Bedbound and relying on oxygen to breathe. This was Michael earlier this week. The 26-year-old marketing executive and amateur footballer caught COVID on a trip to Budapest, a holiday that ended with a stay in hospital.
Yeah, it was quite scary, to be honest. I'd never really experienced anything like that before, no breathing issues at all in the past, so to feel like I was really struggling for my breath was actually quite scary. There wasn't actually enough beds for me at the time, so I got moved into a treatment room. I got a bed sort of put together and I had to stay there overnight. It seemed to be really busy and it seemed to be really ramping up the amount of COVID patients that were coming in.
With no underlying health conditions, Michael says the serious nature of his situation came as a shock.
I hate to think about what I'd actually be like if I wasn't double vaccinated. Apparently a double vaccination helped me with all the COVID symptoms that I've had so far. So if I didn't get that vaccination, then I'd hate to find out what I'd actually be like then.
Vaccination uptake among young people remains much lower than other age groups. While everyone between the ages of 18 and 29 have been invited for their vaccine, just over 2/3 of them have actually received both doses. That compares with 100% of over 60s, many of whom are now on their third dose.
Well, my school was really bad for COVID. So we all got made to get the vaccine.
Some just don't want to, they don't believe in getting the jab. Some too, they just feel reluctant to take it.
Yeah, we've not had work for like a year and a half, so for us to be able to work, I don't mind doing things like that. It doesn't bother me.
Theatres, cinemas and other licensed premises could soon require customers to show proof of vaccination in a bid to curb rising COVID cases. A report released by the Scottish Government today found that the current vaccine passport scheme has led to a slight increase in vaccination uptake among younger age groups. It said extending it would be a better alternative to a Christmas lockdown.
It's for the politicians to decide whether the vaccine certification scheme is extended, but leaving that to one side, I think we really have to communicate more clearly to young people that we're still in the middle of a pandemic. They're at risk and they're putting other people at risk by not taking up the vaccines. And the bigger an unvaccinated reservoir we have in the population, the harder it is for us to get rid of this virus. And that means that any restrictions in future are going to impact on the social and economic lives of these young people.
With Christmas fast approaching, our health and social care services are facing arguably the most significant and increasing pressures in the history of the NHS.
I wouldn't want to feel the way that I did again, so if we can try and prevent that in any way, then I'd definitely try and get vaccinated.
If the vaccination rollout doesn't keep pace with rising cases, we'll be in for a difficult few weeks to come, with more people like Michael needing hospital help. Polly Bartlett, STV News.